Hello, my name is Kayla. Hello, my name is Kayla. I'm going to be doing a presentation on pain management and opioids for ER nursing. Um, so some of the evidence-based tools used um, for this population is an opioid risk tool, SOAPPR, and a GCPS. Picked some of these tools that kind of concern pain scales and opioid risks. So for the opioid risk tool, this is going to ask questions regarding family history, personal history of substance abuse, any mental health disorders that may put them at risk for engaging in substance abuse. And then the GCPS is the chronic pain scale. So that's going to be asking questions and helping providers to understand a patient's chronic pain and uh, them being able to rate their chronic pain and how it is affecting their daily life in the past 3 months, and if it is affecting their activities or their work in the past 3 months. So just kind of understanding their pain scales for the chronic conditions. And then the SOAPPR, the screener and opioid assessment for patients with pain. This one is going to also address people who have chronic pain conditions, and just monitoring their kind of assessing the if how they are using their medications. So asking questions like, are you taking your medications other than prescribed by a provider? Or asking, have you ever been treated for alcohol or substance abuse? And just monitoring for addiction, for symptoms, for those signs and symptoms for those who are on chronic long-term opioid therapies. So the importance of using these tools is to initially identify patients who are on chronic use of opioids, and assessing their risk for abuse. So why this is important and why we need to advocate for this, all nurses have an ethical obligation to assess a patient's pain and managing them according to the ANA. And so, as we've learned, pain is a fifth vital sign, and so as nurses, we do have an obligation to assess and manage a patient's pain and advocate for their pain. Um, and so, how you kind of advocate for someone's pain legally and ethically is by documenting and assessing their pain scores, documenting the medications you're giving them, and educating them on their medications and their opioid use. That way, when a healthcare provider is and you're trying to advocate for them to get a stronger or higher dose, they're looking back and seeing that you did assess their pain, you did give them the uh, correct their current dose and at a timely manner, and you did educate them on their meds and opioid use. And so that they can see that you are doing these things and following legally what you should, how you are managing their patient's pain, and therefore the pain is still not improving. That way, the providers can see, hey, like I'm doing all of this, and they're still complaining of pain. And then also working with local organizations and advocacy groups to work with solutions on how to address chronic pain and opioid dependence, because there can be issues regarding that, people thinking about people abusing it, getting addicted, and so just kind of learning and working with the community and how to address that and how to manage opioids with chronic pain users. Um, and it is important as nurses, our obligation is to continually assessing and monitoring, referring, and communicating with providers uh, for patients regarding their pain management. And so kind of tying into why this is important, there is some issues with stigma, especially regarding those who have socio-demographic factors, including low income, maybe they're homeless, they have mental health disorders, family and personal history of substance abuse. That does tend to lead to discriminatory practices and where people think that they are just coming to the emergency room for because they are drug seekers or they are just wanting opioids. So it is important to understand there is a stigma and to reflect on your own bias as to when a patient is reporting that they have pain and not thinking, oh, this person just wants an opioid. Um, but using that nursing critical thinking skills and really noticing and monitoring and assessing a patient and understanding them and looking and seeing, are they actually in pain or is this someone that um, is struggling with addiction. And at that point, if they are struggling with addiction, as a nurse, it is your responsibility to get them the resources and communicate with them in a therapeutic way to help to understand them and their pain and get them the help that they need. And so that's why I think this population of, and then in this study, low income and incarcerated people are experiencing drug-related discrimination because they are being labeled as addiction and abusers, and just going to the ED to get meds, and drugs. And so kind of being able to recognize that and also prevent that stigma and advocating for these people that they are in pain and is going to overall address this and make sure that people are getting treated. Like I mentioned earlier, as a nurse, you are responsible for treating someone's pain, no matter what socioeconomic factors they have. And this, as a result, is going to improve care when you are listening to someone, you're advocating for them in pain. And when they're telling you, hey, I'm in pain, this isn't helping me, and you being able to, as their nurse, provide empathetic care and understanding and advocating for them that to get them a stronger pain and to address that pain, that is going to ultimately improve their pain levels because they are feeling heard and they're feeling understood and when someone is in a not feeling good and then someone's not listening to them, their pain is just going to increase because when someone feels pain can also just be from, as we kind of learn, pain is how someone understands and mentally reacts to pain. And so being able to be heard and felt, and that is ultimately going to improve care, but also improve pain levels. And addressing this in a way that prevents stigma and biases is going to lead to better treatment, better recovery for patients, and better management of conditions. And these are my references. Thank you so much. That is all.